Hello and welcome to another online lesson. Today we're going to look at part 2 of our journey into the improvements in surgery in the industrial period. We've already looked at pain and anaesthetic. You can find that video on our website at stchistory.com. And this is the follow-up to the second biggest problem of surgery in the industrial period, and arguably the solution today is going to be more important than James Simpson's discovery of anaesthetic and chloroform. By the end of this lesson, you'll have an opportunity to think about both of those discoveries, infection and anaesthetic, and you're going to start thinking about which was the most important. That's up to you, really. We'll talk about that at the end of the lesson. But let's get on to this straight away. Again, this is really fascinating. Just the surgery topic in itself is just brilliant, but also really fascinating in how these things were discovered. All right, so the black period of surgery, just pause the video on your Google Doc or your notes, however you're doing this, and just summarize what the black period of surgery was. Thinking about that lesson with the pain relief, the chloroform, why did it lead to more people dying than before the discovery of chloroform? In a few bullet points or a little mind map, however you want to present it, what was the black period of surgery? When you're ready, unpause the video and we'll carry on. Right, so hopefully you remembered that the black period of surgery was where more and more people died of infections because they were unconscious for longer, with their bodies, their bellies, their chest open to the elements in the air, and the germs were just dropping into their bodies, which caused more infection than before, which led to this black period of more people dying from infections. Okay, so if you didn't get your head around that, or you're still struggling a little bit with that, please ask your teachers. So surgery then, as we know, the odds of survival are very, very low. It's a grim prospect. We talked about Robert Liston in the last video on pain relief. He was the quickest surgeon, caused a few accidents, but generally speaking, he could lob off a limb very quickly. The increased chances of infection are what we're going to focus on today, and that was a bigger problem probably than pain. You might argue that, pain is temporary, so you might have a bit of pain for the short term, I don't know, whereas you're going to die from infection. So probably this is the more important discovery to make. But you could also flip that round as well and say that actually pain is only temporary. So make sure it's quick. I don't know. It's up to you how you do this, but obviously this lesson will provide you with lots and lots of backstory and evidence and facts that you can bring into a really strong argument. So we know people are dying in their huge numbers now because of the black period of surgery. The conditions that surgery was done in were awful. We'll talk about that in a sec. If you're watching this because you missed the lesson, in your Google Classroom, there are lots of videos for you to watch to accompany this, one of which, the Hannah Dyson video, will give you a little bit of an insight about what the conditions were like in the operating theatre, and it's very, very clear why infection spread so easily. All right, so this is where we are. We're going to still move ourselves forward on this idea that surgeons are butchers, they're bad people, that they are not respected in society. They weren't, but this lesson is definitely going to help, and this lesson is going to solve the problem of the black period of surgery. So by the end, we've now solved pain and infection. Okay, so here we are. Joseph Lister is our next individual. Him and Simpson have both tackled this problem head on. He is going to be the person to come up with the use of antiseptic. You might have heard of Listerine mouthwash. You might even use it yourself. Probably named after him, not by him, although the guy who, I think from research in the past, who did sort of create the mouthwash was around at the same time as Lister as well. So very similar time period. So our job today is how are we going to solve the problem of infection? We know it's one of the big three: pain, infection and blood loss. Blood loss is a bit more of a tricky one to do. They had to do it quickly, which led to obviously cutting arteries. I suppose if they're doing surgery much slower, they might be able to avoid some of that blood loss. They did use ligatures, which is basically like silk, to tie off arteries and stuff if they could do that. But of course, the silk is covered in germs. It's gonna carry all sorts of bacteria, so that was never good. Ultimately, it all ends in infection, generally speaking. So that's our story. So the key words for today are carbolic acid, antiseptic, aseptic, and to sterilize. They're common words really today, or certainly antiseptic and sterilizer. We know about sterilizing the house. We know we've got products at home to sterilize and clean the house. We also know in this period, for some context, that Florence Nightingale is designing her hospitals to be easy to clean, tiled walls, tiled floors, things like that. So we know there's this little movement towards hygiene improving. Whether or not we think Lister's more important than Nightingale was in terms of hygiene in hospitals, again, that's down to you, and why this medicine course is just so fascinating and so interesting, because there are many, many ways you could go down this path of arguments. You just have to be really confident. All right, so first little task. Can you read the extract and make a note of at least 3 examples in this little speech, this little box, that would lead to infections? It's very straightforward, but just take a minute or two just to summarize that into at least 3 little bullet points about how that might lead to infection. And when you're ready, unpause the video and we'll carry on. All right, so the gist of what you've hopefully noted down there was that the clothes they wear, they're outdoor clothes, they're coming into surgery without changing them. The instruments are not being washed, they're out in the open, which obviously the germs can fall onto. There's lots of people in the room watching, learning, writing, I don't know, all sorts of things. The more people in a room, the more chance that they're bringing in germs with them. So along those lines, essentially, is what we're looking for here. They are just not bothered. They're not necessarily looking for it because the germ theory, maybe at the start of this little journey, has not really been discovered, or certainly is not being widely accepted. However, Joseph Lister absolutely loves Louis Pasteur and the germ theory, which is probably the exact reason why he took this on and decided to find the solution. So here he is with his little loving of Louis Pasteur. He loves the germ theory. It makes perfect sense to him. And he's determined to sort of bring that into his own job as a surgeon. Remember, the germ theory is the idea that germs are already there. They're everywhere. They're in the air. And they create the bacteria or the rotting, which he disproved, Louis Pasteur, this theory of spontaneous generation. But unfortunately, lots of surgeons, lots of people generally, but definitely surgeons, they still holding on to spontaneous generation a little bit, and even still some hanging on to miasma. So although Lister has taken Louis Pasteur's work, it's going to take a little bit of time, and that shortly does come within the 70s and 80s, the 1870s and 1880s. So again, you could maybe bring this argument in that when we're arguing who's the most important individual in the industrial period, maybe Louis Pasteur, because again, without Louis Pasteur's germ theory, would Joseph Lister be able to do the things that he's doing? All right, so first clue in the story, as always with these things, think about Jenna walking along, just having a little gab with the milkmaids. This is another similar situation for Joseph Lister, but we give these people credit because they took the initiative to think about it and work on it a little bit more. So he's in hospital one day and he noticed this almighty stench. No different really, nothing different from the industrial period as a whole. The sewers, the drains, they were rancid. So he then noticed that they put carbolic acid down into the drains, and the smell went away. So he reasoned, being the individual genius in this story, that somehow the carbolic acid has killed the bacteria causing that smell. Now we know, thanks to the sort of infectious work and the work on Pasteur, that germs, bacteria, rotting smells. We know that, don't we? Rotting bins, rotten food, it has a smell. So because he's so interested in Louis Pasteur's work, he just wondered if this carbolic acid thing kills germs. So of course he comes up with a theory in his own work. He wondered if it might help in surgery. So that's a very quick and probably sort of minimalist backstory to this idea of carbolic acid being used, but his credit is that he just wondered. He asked the right questions. It's always the right thing to do in these places, and we know that all these great discoveries, even the simpler ones, are by people asking the right questions. All right, so in this little the story, in your notes, if you've got your book or just some paper, fill in the carbolic spray some notes that we go from the next couple of slides on this video. But anything else that you're doing, and if you are doing this on a Google Doc, just write some bullet points about carbolic acid as we go. So the first thing you can add to that bubble is that Joseph Lister and the date range that he was around. He realised that deaths from operations mostly occurred from infection. That's his sort of gift to the thing. And while he's thinking of that, he then puts into practice his idea about the carbolic acid and what he's read with Louis Pasteur's work. All right, so he's just put the two things together. He's accepted that most people die of infection, not pain and not blood loss. So therefore, he now wants to go on a bit of a mission to see about cleaning operating theatres, wanting to sterilise, kill germs in operating theatres, because that's what his sort of genius has put together, that these things happen in these dirty conditions. He starts using this carbolic acid that he discovered takes away the smell. he thinks kills the germs that Louis Pasteur's identified or shown that are there. This will get a lot easier when the work of Robert Koch as well, when he's able to actually identify the different types of germs. But for now, we don't really need Robert Koch's work. We just need to know that there are germs, and an antiseptic is going to kill it or kill them. That's the plan. So that can go into your little bubble there, and anything else that we talk about in the rest of this video that is to do with carbolic acid or the carbolic sprayer, pop it into your little bubble or however you're presenting your notes. So here are two images of Lister doing surgery. He's realised the germs killed in the theatre can be a positive, i.e. not killing the patient, and he's used this carbolic acid there, right? So this is the first antiseptic that is used in surgery based on the principles, I guess, of the germ theory, but also the ideas of Florence Nightingale. So she's around in hospitals talking about cleaning up all the time. All of it together is just an absolutely perfect storm of ingenuity, individual genius, and a collective of people just listening to each other and thinking, yes, maybe this can solve this almighty problem of infection coming out of surgery. All right, so then we got this little story, just a nice story really, not for the little boy, but in 1865, a little boy called James, 11 years old. They all seem to be called James in this medicine story, don't they? James Phipps for Jenna. But anyway, if that helps. So he gets run over by a horse and cart, crushes his leg. Normally, that would lead to all sorts of infection, and probably in a kid as well, probably a poor kid, would lead to death. But he decided, Joseph Lister, that if I amputate this boy's leg, he's going to have no future. So that was his sort of human side. But then he's got this theory, remember, about this carbolic acid. And he wonders if he just soaks the wound in carbolic acid, so a bandage and the wound soaked in carbolic acid, he wonders if the kid won't get an infection. And he does this for a couple of days, and he keeps changing the bandages and washing this wound. On the fourth day, you can see there in box number 5, he decides to dilute the carbolic acid with a bit of olive oil as the wound begins to close up. Well, that's just a little thing he's tried to do, herbal if you like. It is healing, but he's noticing that the acid is starting to irritate the skin a little bit. That's probably why he's put the olive oil in. That will come in handy a little bit later on, but for now, the gist of what's happened here is this little boy walks out of hospital with 2 legs and no infection. That was his theory. So he's put the theory to practice, and he's proved that this carbolic acid stops infection only because the high chances are that that little boy would have got an infection before. So here's a good example, and you do not need to go on about the horse and cart and all the rest of it. You just say in an example or a paragraph about Lister that he did this operation on a little boy, smothering the wound in carbolic acid, and he did not get an infection. That's the thing. And obviously Lister is going to do more and more and more operations with this carbolic acid, and his results are going to speak for themselves. You'll see shortly. And he also then starts washing all the tools in this carbolic acid as well, metal tools particularly. This is it. This is the breakthrough. Simple origins, a smelly hospital that he smelt bins, to just the idea. But it's also important to think about here the germ theory. That changes everything. Florence Nightingale's work. Obviously, the Public Health Act is imminent. The beginnings of the end of the laissez-faire attitude with all of these people and politicians telling the government that poor people are getting sick because of conditions, Jon Snow's work. All of it has come together in this period at the perfect time to start making people think a little bit about conditions and dirt and germs. That's just it. Right place, right time, or individual genius. Your job is to decide which of these factors have played the most important part in improving hygiene. All right, so this little summary is just a nice little bit of imagery to hopefully summarize what we've talked about today so far. It's always a good way to help you revise if you can associate images with some of the stories. So just pause the video and talk to yourself, or write a little summary about what these pictures represent and how they show the story so far. Unpause the video when you're ready, and we'll carry on with this lesson. All right, so if you've done that, hopefully your summary is the story of the smell with the carbolic acid, washing the tools, and washing the wounds in carbolic acid. All right, so that's our story. It's the first use of sterilisation in a hospital, and we can see from this source here, source C, that it's being used with this sprayer. You can see there's doctors, it's all a lot calmer, not the pictures we saw in the pain lesson with people being held down by 5 or 6 different blokes. It's calm, the patient is unconscious thanks to the chloroform, and you can see this spray is all spraying all over the place, and you'll see why that might be a problem in a minute when we look at some opposition to Lister. But the gist of the fact is that the patient, open wounds, all the insides open to the elements, but any germ that does fall into the body is going to be killed because of this carbolic acid. And the carbolic spray was Joseph Lister's invention as well, just to get that all over the place. It's going to be messy. It's going to be everywhere. Could be a problem with the scalpel, especially metal stuff if your hands are slippy. And we will talk about that in a little bit. But that's the gist of what we're doing, looking at source C. They still appear to have their outdoor clothes and things on. That's coming later. But the fact is the infection is less likely because of the carbolic acid. So here's some facts for us. This is a really important place just to stop and breathe a little bit as we take this topic forward. You need to be saying who's the most important. And evidence like this is critical into saying why Joseph Lister possibly deserves all the credit for this. So the year or so before, without antiseptics, there were 35 operations. 19 of the patients lived and 16 died. So about a 45% mortality rate. But you could argue is not too bad. This is because maybe things are improving a little bit in terms of general cleaning. But in 1867, after the carbolic acid and after his work with little James, 40 cases, 34 have lived. So a 15% mortality. That is crazy, okay? That is amazing numbers right there. Your job is to get that into a paragraph and just say that Lister has reduced mortality from infection by about, 30%. All right. That's huge. And it goes on to be 100% or certainly 98%. There's always a risk of surgery even today, but the infections after surgery today are more so on the ward, not necessarily from the operating theatre. And that's because they're all aseptic, which we'll talk about at the end of this lesson. So this bit here, get these notes down somewhere. Make sure you're learning some of these facts. The gist of it is that Lister has reduced deaths by infection from surgery by a whopping 30%, and even if a little bit more, down to just about 15%. Now, obviously, this is just a couple of years with just a few numbers. We want to be looking at huge amount of numbers, but if this is sort of spreading to the big numbers, the real numbers all over the country and all the different hospitals, and it remains similar to that, then we can see the big picture is also incredible. This is a good starting point for you to be introducing why Lister is super important, because his impact is actually saving lives. Who can say if Florence Nightingale, apart from when she was in the Crimea, but cleaning tiles, probably has saved lives, has reduced some infections, hasn't it? Maybe the spread of some infections because of the wards, but I don't know if Florence Nightingale's work is as important as this. However, the Public Health Act, where that's, closing down all the slums, toilets, clean water into every house, sewers, arguably in society, that's probably saved thousands and thousands as well. So your job is quite difficult in this industrial period. What's the most important bit of progress for saving lives? Because a lot of the people, a lot of the individuals we've talked about in this period, they are saving lives. But when it comes down to Lister versus Simpson, for example, this is going to be your key evidence as to why Lister might just nick it. All right. So as always in the medicine course, Jenner, Simpson, everyone, there's always seems to be a little bit of opposition to these discoveries. And that's because they're new, sometimes radical, sometimes dramatic. But there are sort of sometimes silly reasons. So let's get these notes into your book or on your Google Doc as to why there was a bit of opposition towards Lister. They cracked the surgeon's hands. They're using it every day, so they started getting blisters. So one way to remember this is Lister makes your hands blister. So that wasn't good for holding obviously their tools. If they've got sore hands, they can't necessarily do operations, which might cost them a little bit of money because they can't work until that heals. So that's one problem why there was some opposition to Lister. The carbolic acid, as you've seen from the sprayer a little bit earlier, gets in the way. I'd imagine it probably looks something a little bit sort of frothy and maybe frog spawny on the body, and you're trying to see inside the body. That might not be too helpful either. And surgery during this black period was suffering. People didn't want to go for surgery because more and more people were dying. So Lister's got a bit of work here to try and persuade everybody that he's found the solution to the black period. By accepting this theory, and this is one that we've talked about previously in this medicine course, if Lister's correct, then what it means is that many surgeons have been responsible for killing people in the past. Their dirty clothes, their dirty hands. So for them to be able to come to terms with that and accept that they've been doing it wrong, they have to come to terms with the fact that they have probably contributed to the death of people. And that would be quite hard to take, I think. That's an important human distinction to make here. So a lot of them just couldn't believe it, couldn't accept it because they couldn't accept their own I suppose, responsibility. Carbolic acid obviously makes it difficult to use the equipment. We've mentioned that, especially those metal ones with this spray everywhere. And many surgeons still don't quite believe that germs can cause infections. They're so small. We've obviously talked about when we did the germ theory lesson that they're so small. People say there's germs everywhere in our gut, in our mouth, and we don't all get sick. So how can this happen? And they're so small. Still a few people hanging on to miasma, more people hanging on to spontaneous generation. But as we get into the 70s, and definitely towards the end of this century, there's not that many people left in any doubt that germs do cause infection. A lot of Pasteur's work when we was on liquids, that's why you got a little bit of a hard time on that. So we've got a bit of opposition to Lister here, and you might use some of that if you're arguing as to why Simpson or another individual might be more important than him. But don't necessarily go on a big rant attacking them. That's not our job in this medicine course. Our job is generally always to be focusing on the impact of these individuals or this factor, science, technology, government. And that normally is why was there progress. But these are certainly things to consider as to why Lister might not necessarily run away with the prize. All right, so let's look at two new terms, really. Antiseptic, we should be well aware of that. We've just spent years coming back after COVID, haven't we, washing our hands with this antiseptic gel. You might even be carrying some of that around with you on you now. You might use it a lot. You know that there's loads of antiseptic stuff at home, in the bathrooms, probably bleach in the kitchen, Dettol spray, all sorts of bits. Antiseptic is 99.9% killing all germs. It's a liquid, essentially, a chemical, which might not necessarily be good for our lives, our health, and our surfaces at home, but it kills germs. So that's what's happening in the late bit of the 19th century since Lister's been around. Carbolic acid, the problems we've talked about, the blisters, they're getting in the way, all of that stuff, but fundamentally it works. And it kills germs. Then we move on to aseptic surgery, which is this newer idea, and it takes it one step further into the 20th century and obviously beyond into modern times. The 21st century is steam cleaning, all right, or steam sterilizing. Some of you may well have steam cleaners at home. They are better for the environment, for our health, for surfaces, of course. It's just really, really hot water. So they start steam sterilizing the operating theatres after an operation, ready for the next patient after that. And it's about, rightly so, 100% germ-free. If you can make a place aseptic, that basically means 100% germ-free. So this steam sterilizer on the side was invented by Robert Koch, who not only has he contributed the identifying germs and explaining how to make vaccines, he has created this little bit of technology that helps to steam clean. Even today, after an operation, the scalpels and anything that's metal essentially is after an operation sent away to be steam cleaned in these massive steam cleaning factories or plants and then sent back to the hospital to be reused again. Of course, they do have single use tools as well, but anything that's metal will be sent back steam cleaned. It makes it 100% germ free. So we've got the solution to the cracked hands and the mess and the carbolic acid everywhere, but it is really Lister's explanation. It's Lister's progress that led to the aseptic. We give him the credit for it because he's obviously shown it works, and other people have then tried to I suppose, find solutions to the problems that arose. That is what people do. Engineers do it. Wherever there's a problem, people's jobs is to find a solution. And they found the solution in aseptic surgery, but that's more into the 20th century. So if you're thinking about that question 3 again, the first medicine question after the trenches bit, one thing about surgery or hospitals in the medieval period to the 20th century, you could maybe talk about the dirtiness, the cleanliness, one difference. One is really dirty and one is really clean, or something like that, or a similarity in the industrial period to the modern period. You could say they both focused on cleaning. Similarly, one is antiseptic, the spray, and one is aseptic. They're both essentially the same thing, so the word's similar, but slightly different as well. You could talk about those things, all right? So good little examples to always have in your arsenal, really, to be able to answer that question 3. One thing they thought in that period and one thing they thought in that period, and why. Why did they think these things? And generally speaking, especially as we go into the more modern periods, it's because there's been a discovery of some sort that has led to that idea. All right. So 99% germ free, 100% germ free. I think people just say that on these, bottles of Dettol or whatever, or bleach, just to cover them in case someone does get sick. They can say, well, we said 99.9%, covering themselves. But essentially speaking, steam is 100% germ free. So this little graphic you can see now is basically trying to give you a time picture, 1860s down to the 1890s. In the short term, surgery hasn't really changed that much, just because of a little bit of resistance for all the reasons that we've talked about, the blister and the spray getting in the way, as well as that idea about spontaneous generation and stuff. But as we get past 1870, that's sort of our turning point on this timeline. Attitudes have changed significantly, and that is arguably because of the germ theory, because of the work of John Snow, the Public Health Act, the end of laissez-faire, Florence Nightingale cleaning her hospitals, but also you just can't argue with the facts and the statistics from this Lister lesson. The amount of people who are now no longer dying, people start stepping up and listening. You can't argue with it. So in the longer term, attitudes have been changed. Antiseptic and then aseptic methods are being developed all the time, which improve surgery and improve the mortality rate, almost to the point today where it's a guarantee that you will not probably die from an infection today in the operating theatre. You might die from that infection on the ward, but certainly not from the operating theatre. So that is our progress, and that is Lister's impact, if you want to discuss that. But the turning point is the 1870s. That's where everything seems to start picking up some pace. The sewers are being built. All of those things, they're building houses with clean water and their own toilet supply, all that pressure from MPs and politicians that we've talked about in the past to start cleaning up these slums. There's no surprise, really, is there? The 1875, the Public Health Act, and the germ theory in 1861, all of these things start leading to the progress. Robert Koch identifying germs and being able to make vaccines. That's the turning point. Our job, really, is to argue why. Why did it happen then? Who's the most to blame for that? It's hard, really, to argue against Louis Pasteur and any of those things, but you're free to. So make sure you do as well. All right, quick revision exercise. If you are watching this for Year 11 revising, or if you're just watching it because you missed the lesson, take a little bit of a chance here now to think about this little task. Basically, if the answer is James Simpson, make up a question. So it might be, who discovered chloroform as an anaesthetic? The reason why it's a nice little task to do is it's cognitively very strong. It's making you think a little bit about the topic and about the questions that you're answering and asking. So it's really powerful, actually, and an easy thing to do when you are revising and you're looking for sort of little bursts of tasks you can do fairly quickly that are valuable. Then this is one of them. So if 1847 is the answer, what's the question? All right, that'll be, when was chloroform discovered by James Simpson, and so on. All right, you can do this with any topic. It works perfectly well for Macbeth, Romeo and Juliet, whatever it is you're doing, Christmas Carol. These are the answers. You make up the question, and that, as I say, that cognitive power is really good, a really good use of revision time. Once you've come up with some questions for these answers, unpause the video and we'll finish this lesson off. So, impact. All right, all said and done, a wonderful, clear, nice, straightforward lesson. One Lister's done, for infection. So these are the bits that you are going to include in your essays when you're arguing for his impact, his importance, especially in comparison to other people. So he's responsible for the breakthrough in fighting infection in surgery, especially as he studied Louis Pasteur's work. He's ensured that instruments, the patient and the surgeons, and even the air are being drenched with this carbolic acid to try and kill as many germs as possible. Obviously, in these early days, that might not kill every single germ, but it's going to be doing a really, really good job of it. As we've seen, the death rates went from 45% down to 15%, so really good success rates, and it will be probably that 15% just because a little bit was missed or something like that. They're not perfect yet, but they get perfect and they advance as they go through. So 10 times more operations are now taking place by 1912 than were taking place 40 years before. And that would mean, sort of naturally, more people dying of infection. But of course, they're not. There's now 10 times more operations happening with much less infections. This raises people's confidence and their willingness to go for surgery. That's why Lister is so important. The steam cleaning has been developed by Robert Koch, and this William Halstead is an American who invented gloves. That solves the problems, doesn't it, of the carbolic spray causing blisters, as well as masks. All of these things are really common sense to us today, but they weren't. And that's where we've got to give these people credit for pointing this out and saying what's good about it. All right, at this period as well, there's another guy in the story who's not in our spec, but he's quite important. His name is Semmelweis. Semmelweis basically was in a hospital, and he realised that a lot of women were dying of childbed fever after having babies. And he realised that the women who died were the ones where the doctors had helped deliver their babies, and the ones where midwives had helped, they didn't die. And he sort of used his genius there to realise that the doctors have been doing autopsies or surgery, and they haven't been washing their hands. That's why when they went and helped deliver babies, and obviously there's a lot of blood and mess down there, isn't there? They were touching that and spreading their germs that were on their hands. So Semmelweis took a lot of flack. He was ridiculed a little bit, but he was determined that every single person in his hospital washed their hands, and the death rates from childbed fever plummeted. Just another example. You can talk about Semmelweis. He's not in our spec, but you can still talk about him as an example of the change in attitudes in this period. But this bit here in dark blue is the bit that you definitely want to be including in a paragraph that argues for Lister's importance. Surgeons are now fully aware, and they understand that safe surgery is possible, and that it is now in fact their duty to keep their patients alive. This is a big attitude change, isn't it? A big shift, especially from those barber surgeon days where, to be honest, if you lived or died, it wasn't really bothered to them. They still got paid, and lots of people died, so they were used to it. Now it's their duty. This is why surgeons have now got this much more respected profession today. They wanted to do everything they could to make sure the patient didn't die. They now know that it's possible to have safe surgery, so it now is their duty. That's the key bit here. And of course, for the people, it's now safe to be operated on, especially aseptic, as we go into the 20th century in a germ-free environment. So Joseph Lister absolutely is critical in all of this. If you're arguing his importance compared to, Nightingale for hygiene, for me, Joseph Lister, is far more important than Florence Nightingale. They're both only, though, in hospitals, perhaps you could argue, but this would change attitudes out in real life. Maybe the Public Health Act is more important in terms of hygiene in society because it affected society. They cleaned the slums, they built the new houses, the water supplies, the toilets, all those things that affected far more people than just those having surgery. I don't know. They're the kind of things that you might want to go down on this little route. And this is a nice quick diagram just to have a quick look at what's happened from the start of this industrial period to the end, what's changed and what's continued. As always with this medicine course, we want to be aware of changing continuity, especially for question 3, that little 4 marking, all right? So have a little read of those things, and when you're confident on that, we'll move ourselves on. So here we go. Here's the argument. Who was more important? If you are watching this as a revision video and you're in Year 11 preparing for your exams, then the tasks you can see on the screen now are, again, really effective uses of revision. We know that by sitting writing loads of notes and highlighting and doing a bit of reading, we know that's not really an effective use of your time. So doing is always better to be doing something. Exam questions are like the best thing you can do, but creating something, flashcards, timelines, mind maps, whatever it might be, the doing is far more important. And this gives you an opportunity to practice some timelines for the whole of the 19th century in relation to just surgery. You can obviously do one of these things on a massive scale relating to the whole of medicine in this period, but just focus on surgery. Then you got Lister, you got Simpson and all those kind of bits, and then some flashcards of their facts and things they did and things they discovered, why they're important. And then the most important bit with a friend, if you can, is to debate, give one and one another. Obviously, podcasts are a good way to do this, where one person's arguing for Lister, one person's arguing for Simpson, one person maybe arguing for Nightingale, and so on and so on. This is how your revision can be just that little bit more, I suppose, interesting, but more importantly, effective. All right, so here is an opportunity for you to do a practice question, a 12 marker. The question here says, explain why there was rapid change in surgical treatments in the period 1700 to 1900, so the industrial period, and the bullet points they've offered you chloroform and Lister. So they've offered you basically pain and infection. Your third one of your own, you can pick from the red bullet points on the other side. Some of those might even go into a couple of bits. So technology, you might use that as your third paragraph. That's what's led to all the change. change because the technology, the steam sterilizer, the carbolic spray, the gloves, whatever it might be, those things have solved the problems that you might have talked about in the other paragraphs. So this question is a lovely question. 3 clear paragraphs on why surgery got better. That is what you're basically talking about. Maybe attitudes for your 3rd paragraph have changed, surgeons, how they see themselves, whatever it might be. Try really hard in this 12 marker to be positive. It's always asking you why something happened. It's not asking you necessarily for a judgment of who's most important. If this was a 16 marker, it would say, I don't know, Joseph Lister was the most important individual in this period for hygiene. Do you agree? So you'll do again a Lister paragraph, you'll do a chloroform paragraph, and a 3rd of your choice that is related to the topic. That's the same. The gist of this 12 marker and 16 marker remains the same, but the 16 marker requires a judgment and the conclusion. And that's where you might bring in a little bit of negative into each of these paragraphs to help you analyze and argue, okay, he's good, this is great, but this happened and this wasn't so good. Whereas all of that kind of language, whereas on the contrary, those kind of things are going to help you smash your 16 marker, but also it's still useful to practice in the 12 marker as well. Always a little bit of analysis too, and that helps with your English exams too. So have a go at this question. Either do the 16 marker or do this. They'll be in your booklets for our school for you to get your head around this topic. As topics go and as 16 markers go, this one, it'd be an absolute dream because it's so easy really to just note down what these big discoveries were. And of course, because it's a change question, you need to be thinking what it was like before. So don't forget to describe, how awful the conditions were, wearing their outdoor clothes to do surgery, not washing the tools, and now what they do after. And then you've got your 12 marks in the bag. So have a go at that, hand it in to be marked. And as always, if you've got any questions from this lesson, please let your teacher know, and we'll try and iron that out for you. But again, a nice sort of broad, open topic that you can really get your teeth into a bit of an argument. And the easier ones to practice your argument language are important, because when we come to your exams in the summer of year 11, we want you to be really confident that you can just say yes, 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 but, yes, 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 but, and however, on the other hand. Those are the key bits for you to get the very, very highest marks. Yeah, you need to know a lot of stuff. We know that. But with a topic like this, you can see that there's loads to know and there's loads to leave out as well. All right, so as always, thank you very much, and we will see you again for our next video. Thank you so much, and goodbye.